Histology of uterus. Before going into the topic proper, I would like to mention some anatomical and physiological points regarding the uterus. So uterus is a pear-shaped, thick-walled, hollow muscular organ situated within the pelvis. The main parts are fundus, body and cervix, and the measurements are: length is about 7.5 cm, breadth is about 5 cm, thickness is about 2.5 cm, and weight is about 30 to 40 grams. So this is the uterus, and you can see the dome shaped fundus. So this is the part of the uterus which lies above the entrance of the two uterine tubes. And next part is the body. It has the uterine cavity which is continuous on each sides with the lumen of the uterine tubes, and it is continuous below with the cervical canal through the internal os. And next, this one is the cervix, and it has cervical canal which is communicates above with the uterine cavity through the internal os, and below with the vagina through the external os. It has numerous mucus secreting cervical glands which keeps the vaginal mucosa moist. Next, about the histology of the uterine wall. It has endometrium, myometrium and perimetrium from inside to outside. Let's see one by one in detail. First, about the endometrium. So endometrium is the mucous membrane of the uterus. It consists of lining epithelium, lamina propria or stroma, and uterine glands. First, about the lining epithelium. Before menarche, it is lined by ciliated columnar epithelium. During reproductive life, it is lined by simple columnar epithelium. The surface epithelium will invaginates into the underlying lamina propria and forms the uterine glands. Next, about the lamina propria or stroma. It is highly cellular and consists of abundant intercellular ground substances. It has embryonic stromal cells, numerous blood vessels, lymphatics, nerves and simple tubular uterine glands. These glands are lined by simple columnar epithelium. The endometrium presents two principal layers. They are basal layer and functional layer, also known as stratum basale and stratum functionale. The stratum functionale is formed by stratum compactum and stratum spongiosum. As the name indicates, the stratum compactum is formed by compactly arranged cells and stratum spongiosum loosely arranged cells. Let's see the main differencing point between stratum basale and stratum functionale. First, about the stratum basale. This is the basal thin layer, lies close to the myometrium, and it is supplied by straight arteries. So this will not exfoliate during menstruation, and this basal layer helps in regeneration of the endometrium after the menstrual flow ceases. Next one is the functional layer. This thick superficial zone is the stratum functionale, and it will show the periodic changes during the menstrual cycle, and it is supplied by the coiled arteries. These are the coiled arteries supplying the endometrium. This is the coiled arteries, and this most of the layers undergo shedding during menstruation. Next one is the myometrium. The muscular layer of uterus is known as the myometrium. It has three ill-defined layers. They are outer longitudinal, middle circular, and inner reticular. This outer longitudinal muscle layer helps in the expulsion of the uterine contents, such as in parturition. And the middle circular layer acts as a sphincter of internal os and helps to retain the fetus until it gets fully developed. And next, inner reticular muscle layer contains most of the blood vessels of the uterus and known as the stratum vascular. This layer acts as the living ligature of the uterus, as it stops the hemorrhages in the menstruation and also during the separation of the placenta by the contraction of these muscles. Next one is the perimetrium. It is the outer connective tissue layer formed by the peritoneum, and it invests the entire organ except the lateral borders of the uterus, where it is reflected towards the lateral pelvic wall and forms the broad ligament. Next, about the menstrual cycle or uterine cycle. So what is menstrual cycle? The periodic structural changes of the endometrium during the reproductive life is known as uterine cycle or menstrual cycle. The hormones liberated from the ovary during the ovarian cycle regulates the various phases of menstrual cycle. There are mainly four phases seen in the menstrual cycle. They are menstrual phase, proliferative phase, secretory phase and ischemic phase. In histology, you have to draw only two slides of the proliferative phase and the secretory phase. So let's see one by one in detail. First, about the menstrual phase. As you know, the duration of the menstrual cycle is about 28 days, and this menstrual phase will start at the first day of the menstrual cycle and last about the day 5th of the cycle. During this phase, the greater part of the endometrium will shed off, that is mainly pars functionalis will shed off, only the pars basalis will remain. Along with that, the greater part of the glands will also lost. These changes will occur due to the low levels of estrogen and progesterone. But at the same time, a follicle is beginning to develop and starts producing estrogen. This figure you know very well, that is our hypothalamus produces gonadotropin releasing hormone which will act on the anterior pituitary and produces FSH and LH. This will act on ovary and produce estrogen and progesterone. Both these hormones will act on the endometrium and causes these cyclical changes. Next, about the proliferative phase. When the estrogen levels are high, lining epithelium is reformed by the proliferation of the epithelial cells in the basal part of the glands. Stromal cells proliferates and secretes collagen and ground substances. The endometrium will increase in size. Uterine glands are straight, tubular and dip into the stroma. The estrogen also stimulates blood vessels to develop. This proliferative phase will end with the ovulation on day 14. So, in this figure you can see the endometrium begins to rise in thickness and it is supplied by the arteries, and these changes will occur under the influence of the estrogen. This is the histological diagram. You can see the endometrium lined by the simple columnar epithelium and the uterine stroma containing compactly arranged stromal cells, and also the connective tissue and simple tubular uterine glands lined by simple columnar epithelium, and also you can see the myometrium along with the blood vessels. And this is the slide of our department. You can see the lining epithelium lined by the simple columnar epithelium and the uterine stroma containing condensed compactly arranged stromal cells along with the simple tubular uterine glands lined by simple columnar epithelium. And this is how you have to draw in your records, that is uterus in proliferative phase containing lining epithelium lined by simple columnar epithelium and stromal cells are compactly packed along with the connective tissue, and you can see the simple tubular uterine glands lined by simple columnar epithelium along with the blood vessels, and you have to draw the myometry like this, that is longitudinal and circular fibers along with the blood vessels. Next, about the secretory phase. After ovulation, the corpus luteum begins to produce progesterone. Estrogen levels also remain high, so there will be increased amount of tissue fluid in the stoma. Also, increased tortuosity of the spiral arteries can be seen. There will be accumulation of secretions within the glands occurs, and the glands will dilated and convoluted and present as corkscrew or saw-toothed appearance. There is increase in the size of the stromal cells due to accumulation of the glycogen and lipid droplets in the cytoplasm can be seen. So these changes in the stromal cells are called decidual reaction, which will occur during the pregnancy. So here you can see in secretory phase the endometrium size will rise, and along with that spiral arteries will give blood supply to the endometrium. These changes occurs under the influence of estrogen and progesterone. So this is the histological picture, that is lining epithelium lined by simple columnar epithelium and stroma containing the stromal cells which are pushed away due to the filling of the glycogen and lipid droplets, and you can see the connective tissues, and you can see the saw-toothed appearance of the uterine glands which are lined by simple columnar epithelium along with this spiral arteries, and you can see some amount of myometrium. And these are the glandular changes during proliferative and secretory phase. During proliferative phase, the glands are simple tubular, and secretory phase it is saw-toothed appearance. And these are the two slides of our department. You can see the glands are arranged in sawtoothed appearance here, here and here. And you can see little amount of the stroma along with the stromal cells. And this is how you have to draw in your records, that is uterus in secretory phase. You have to draw the lining epithelium lined by simple columnar epithelium, and in stroma the stromal cells are pushed away, and the uterine glands are sawtoothed appearance lined by simple columnar epithelium. And you can also draw the spiral blood vessels and also the little amount of myometrium. Next is about the ischemic phase. On day 27 and 28, estrogen and progesterone levels will fall because the corpus luteum is no longer persist. Without these hormones to maintain the blood vessels, the uterine lining becomes ischemic and it will slough off, and the next menstrual cycle will begin. Next, about some clinical conditions, that is fibroid uterus. It is a non-cancerous tumor of the uterus. The cell of origin is smooth muscle cells of myometrium. You can see the different types of fibroids in this figure, that is intramural within the myometrium, the subserosal, it is outside the perimetrium, and the submucosal within the uterine cavity, and these are of two types, pedungulated and the fixed type. And here you can see the normal uterus along with the hugely enlarged fibroid. Next one is endometriosis, that is in this presence of endometrial glands and stroma in abnormal locations outside the uterus. The most common site is ovary. If it is present in ovary, it is present as a chocolate cyst of ovary. And the other common sites are fallopian tube and broad ligament, also anterior cul-de-sac and posterior cul-de-sac. Next one is adenomyosis. It is also abnormal distribution of the histologically benign endometrial tissue within the myometrium along with myometrial hypertrophy. It will also present as a uterine mass, but the difference from the fibroid is, in fibroid the cell of origin is myocytes from the myometrium, but in adenomyosis it is cell of origin is endometrial tissues. So that's all about the histology. Thank you.